Your Excellency, in August of 2022, the people of Kenya were offered a choice. They were not offered slogans. They were offered a plan, written down, published, in which universal health coverage stood as one of the 5 pillars of our national transformation. Kenyans read that plan and they give it their mandate by electing you as their 5th president. 4 years later, we have come to this hall to do something that is rare in the politics of our country and in our region. We have come to place that plan side by side with a record and to invite the whole country to compare the two. And I want to say something about why this was possible, because it is not a technical story we want to say. It's also a political one. Every government that has ever governed Kenya knew what was wrong with our healthcare system. The diagnosis was never a secret, but it is set in reports. It was found in commissions. It was found in expert panels, in the exit notes of the departing officials, including presidents. But what was missing was also never the analysis. What was missing was a head of state willing to spend the political capital. On National Equipment Support Program, equipment, Your Excellency, because a clinician without a diagnostic is a clinician guessing. Under the National Equipment Support Program that you introduced as one of the key pillars of universal health coverage, as of 30th July 2026, we have installed medical equipment valued at 9.68 billion shillings in 251 health facilities across our 44 counties, showing 239 county facilities and 8 national facilities. Let me be very specific about what that means at the bedside. It means 36 CT scans, it means 2 MRI machines, it means 52 digital X-rays, and it means 72 ultrasound machines that have been provided. Consider what that changes. Not long ago, a Kenyan who needed a CT scan had 2 options: travel to Nairobi or go without a diagnosis. Today, that equipment is available in the great majority of our counties, and it's paid for by Taifa Care, not by the national government and not by our county governments. Your Excellency, a health system on health commodity security. A health system is only as credible as the medicine on its shelves. When this administration came into office, the national order fill rate at Kenya Medical Supplies Authority stood at 35%. In plain language, a facility that ordered 10 essential commodities received fewer than 4. Today, that rate stands at 95%. We restored the authority's balance sheet by recapitalizing KEMSA through 10 billion shilling credit facility arranged with one of our commercial financial institutions. And we did that because there's no supply chain in the world that functions without working capital. We have operationalized the Embakasi Supply Chain Center, and we have strengthened our regional distribution hubs in Kisumu and Mombasa. And we have moved the entire chain from paper to platform. Your Excellency, today KEMSA supplies more than 11,400 health facilities, and 54% of everything it distributes goes to primary health care at level 2 and level 3, the dispensaries and the health centers, where most Kenyans seek care. What this means for an ordinary Kenyan, Your Excellency, is very simple. The mother who walks to a dispensary with a prescription in her hand now finds the medicine at the end of the queue, and not a referral to a chemist she cannot afford. Tonight we have the Town Hall Health Summit. And we want to answer all the questions We want to answer all the questions concerning the health care system in Kenya. We want to answer all the fake headlines for 4 hours. Because as I said, we had a plan, and now we are presenting the record so that the people of Kenya can compare what we promised, what we planned, and what we have delivered as of now. Your Excellency, in the first year of your administration, you chose to retire an institution that has served this country for nearly 6 decades, that employed thousands, that had a constituency of its own, that has defeated the reforming intentions of every government before you. You were advised, and I know because some time is set in those meetings, and it could have been safer for you to amend, it could have been safer for you to postpone, or to pilot the way some of your predecessors have done, or to appoint yet another task force. You declined all those offers. You went to Parliament as our president, and you asked for the 4 new laws. And that's why the Speaker of the National Assembly and the Committees of Health are here. And when the transition proved difficult, as deep reforms always do, you did not retreat into silence. You went out and explained it publicly in every county in this republic. And that's why we are here today. Not because the Minister of Health is clever, but because this reform had a political ownership at the very top, sustained for 4 years, and the technical machinery built deliberately underneath.